Coronary heart disease is a form of heart disease. Globally, it is the #1 cause of death. One of the diagnostic tools used to diagnose coronary heart disease is CT angiography. Candidates for computed tomography angiography are usually patients who don't have clear stress tests or who have unusual symptoms of coronary artery disease. What is computed tomography angiography? CT angiography is an exam that uses a special X-ray machine to view blood flow all over the body. CT takes pictures from different angles, which then joins them together to show detailed pictures of the vessel. Who should undergo CT angiography? Patients who have intermediate or high-risk profiles for coronary artery disease, but who do not have typical symptoms, should undergo computed tomography angiography. Preparation. Before the exam, the patient will receive a contrast material, which will be injected to a vein, which would then make the vessel more visible in the pictures. The doctor would then attach electrodes to the chest for ECG gating. The patient would then be instructed to hold the breath for 10 seconds. If the breath is not held properly, multiple artifacts would then occur. ECG gating. The purpose of ECG-gated scanning is to obtain a stop-action image of the heart. Each of these images theoretically represent only a selected phase of the cardiac cycle, such as end diastole. Acquisition of images. When the patient is on the table, acquisition of images begin. The acquisition is started with scout images, which define the field of view. Next, calcium score imaging is done, after which the contrast dye is injected to begin the CT angiography. Post-processing is then done in the workstation, where the cardiologist or the technician interprets the results. The advantages of computed tomography angiography compared to conventional angiography is that it is non-invasive, it is relatively painless, it requires no hospitalization, it is fast, and it captures cross-section images of the heart. The future of multi-slice CT technology holds great promise for non-invasive diagnosis of heart disease. The introduction of 64-slice scanners has greatly improved spatial resolution. It holds the promise of reaping the benefits of diagnosing heart disease without invasive conventional coronary angiography. This tool is likely to develop further as a complementary tool rather than a replacement to conventional angiography, especially in patients where heart disease needs to be ruled out.